All right, Shamika. Well, I'm really glad that you were able to come in and meet with me today. We covered a lot of ground today, and I know some of the stuff we talked about can be pretty overwhelming. You have a lot of decisions to make. So I just want to kind of recap. We talked about your sister's needs and what your concerns were around like her behaviors and her medications. And the new skills that you would like her to learn while she's living here with us. We also kind of talked about your concerns with the proximity to your family and being able to come visit her and take her out with you guys still. And we'll definitely be able to make those things happen for you. Is there anything today that maybe you feel like you wanted to cover? Any more questions that you have that we haven't gotten to?
I know that one of my concerns was possible psychiatric meds, or anything, because I know that she struggles with what I think may be depression, but that's just me, in my opinion. Is there a way for her to get a psychiatric, needs med if that's possible? I don't know how that necessarily works with the developmental population, but
Yeah.
I wonder, is that possible?
Yeah, most definitely. Our staff are very trained here to handle those needs if they arise at the house. But we do have a full team behind her to support her with those behavioral needs or those psychiatric needs, along with our nursing and our physical therapy and occupational therapy. So the whole team will be behind her. And if she does need some more assessment in those areas or even a short inpatient stay and then come back to us, that is definitely something that we can look at as we move forward.
Okay, that sounds great.
Right,
Other
well,
than that, any questions at all?
okay, great.
Right.
Well, I'd love to set up a time both to meet her and to take you on a tour of our residential facility. So if you don't have any other questions, let's walk up front together and we'll get those scheduled. Sound good?
Yes, it does.
All right, wonderful. Thank you for coming in.
Thank you.
Cool.
Alrighty. So I'm gonna just go into mine. Is that okay?
Mm-hmm.
And you would just want to use your name as the character.
That's fine.
Okay. So Amber, we're coming to the close right now of our interview today, and I just want to recap on everything that we talked about today. You said that you were coming in here for what you feel is increased alcohol use because you felt like you've been having some stressors at home with keeping up with your kids' schedules, going about their day-to-day lives, and also, keeping up with your husband's schedule and things that you guys have going on. And I know that you also discussed having some issues with loss of work, in which you were recently laid off, and you said after that you kind of began to pick up on some of the increased drinking at home, which you have described as being very problematic for you, as it is becoming something that is becoming a very big habit in your life. And I also know that we talked a little bit about that you were engaging in alcohol. You said you were drinking about 4 to 5 beers or alcoholic beverages a day, and you said that that was out of the norm for you, as you normally only drink maybe once or twice out of the week, and yet it's escalated to about 4 to 5 drinks within a day, and it's becoming out of your norm. We talked about some possible treatment recommendations earlier, and you said that outpatient may be too not as structured as you would want it to be. And so before we get into possible recommendations, I also want to talk a little bit about the mental health that you also came in for. You said that you did struggle with depression in your past, and it may be something that we need to continue to look at again as you go through the treatment process, and that you were on some meds, but that they were discontinued, and you would like to look at those again. You said that you had some really positive family supports as well, that you can really lean on your mom, you can lean on your brother and your husband and your father as well, as people that you can go into your life and talk about these issues. And you also did mention that you had some really effective coping skills, such as reading, listening to music, talking with other people. And so those are some strengths that we are looking at in the recovery process for you as well, as something that we can use to help you get through the recovery journey, as we call it here. I really want to explore the treatment recommendation of inpatient, as you believed earlier that the outpatient treatment wouldn't be as structured for you, is not what you would quite need. Is there any concerns with the inpatient treatment, if that's an option for you?
Yeah, like you said, the outpatient is may not be as structured for me, but I am really worried about not being able to see my kids and my husband while I'm in there. Is there still a way I can see them?
Of course. We have visitation twice a week here. So one time on Wednesdays and another time on Sundays. Those are usually the days that we have designated for visitation. But if for any reason you want to see your children or you want to see your husband, they can schedule an appointment with us so we can get them in at any time. That's going to work for everyone on your team and what's going to work for you as well. So even though we have those 2 designated periods, those are just programmed in there. But if you need extra visitation time, if you need a different day that's going to work for you, we can definitely get you in to see your family and just schedule that out within the daily ongoing schedules of the clinic. Like something that can be beneficial for you in inpatient treatment?
I think so. That's really my biggest concern is I don't want to be completely cut off from them.
And I completely understand that being a big concern. It's a lot of people's concern coming in, having that distance away from their family. But yes, we can accommodate those needs.
Okay, good. Thank
Do
you.
you have any other questions?
I don't think so right now.
Okay. So right now we're going to go with the treatment recommendation of inpatient treatment. What we're going to do following this interview, we're going to get you over to a therapist so that they can get you a formal diagnosis. And the way that they're going to do that is go through some assessments that they have to get you that formal diagnosis. And then we're going to introduce you to your clinical team here. And does that sound like something you're interested in for the day?
Yes. It sounds like a lot.
I know, and it can be really frustrating, and I know this can be a process, but I think what we do well here is getting everyone's needs met, coming in for that initial intake, and going through all the different, areas that they need to go through just to get completely in the door, just so we can start that process of doing the therapeutic services and getting you case management services and therapy and all those things that we provide here. So I know it's a process, but it's a good process at the same time that's going to be beneficial for you in the long run. So, but if you have any concerns about the process, or if it's moving too fast, it's moving too slow, I'm sure we can make some accommodations in that area as well. Some therapists work faster than others.
Yeah. Okay. Thank you.
Okay. So at this time in the hall, we're going to go and walk down. I'm going to get you some resources for NA and AA groups that you can attend while you're here, just to give you a little bit more insight into the program. It will be approximately a 60-day program. So you can get out earlier and you can get out later. It depends on how your needs are being fulfilled within, the agency, and are you meeting your goals and things of that nature. So at this time, we can go ahead and step out into the hallway and go ahead and get you to your therapist.
Wonderful. Thank you so much.
Thank you. It's nice to meet you.
You as well.
Okay, so that was our closure treatment plan. We're done.
You really froze. I don't know if we're still on or not.
Okay.
I just texted you. You were so frozen.
You were too for a minute, so I'm gonna check and see.
It still says live on my end. Is it live on your end still?